So let's go ahead and talk about the extremities. So what are the most common extremities you treat, and what is the most common classification you see on your practice?
Well, if we start out with just how many spine to extremities I see it, I think the last time I checked, it was about 45% spine, 55% extremities, or at least they come in, thinking in an extremity. And so out of those, I'd say I see mostly shoulders and knees, not out of choice. It's just what comes through the clinic. But I also get a fair bit of elbows, wrists, hips, and ankles as well. So I think I get a good mixed bag of all these extremities. So it helps me to be well-rounded.
Great. And what percentage of extremities derangements you see coming from the spine? And how do patients react to the idea of treating a spine versus extremity, that it is what they think is where is the problem, right?
Right. So the percentage, I haven't kept tabs on the percentage of extremity problems that originate from the spine, but I mean, we have the 𝐏𝐵𝗲 study for that. I don't know if you're aware of it. It is joint dependent. So typically, the further you move away, the more distal you are from the spine, the chances of it decreases of it being a spinal problem, typically speaking. But yeah, I haven't had a lot of problems with that, to be honest. I think it's the way you present the information. So I would go through my history, and depending on what they tell me, I might tell them right there that, look, let's say someone complains of knee pain, for example, and you're realizing it's anterior, posterior, medial, lateral, bit of tingling here and there. I think depending on how adamant they are about that being their knee, or if they start to tell me, oh, I don't know what's going on, then I'll tell them, look, there's a possibility that this pain, sure, it's maybe coming from your knee, but there's another source that could be your back. And some people may be aware of it, some people may not, and it depends. I think if I present it like that and I tell them, look, we're for sure going to take a look at your knee, okay, but in order to be thorough, we're also going to take a look at your back, if that's okay with you. And 99% of people would say, yeah, sure.